This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about when medical malpractice happens. If you like this video, we put out new content weekly, so please like and subscribe. So medical malpractice. There's a few things that need to happen for medical malpractice. One, and this is probably the most important one, is there needs to be a violation of the standard of care. What does that mean? That means that doctors generally do the same thing all across the country. And there's slight variances, but there's generally an accepted sphere that's considered things that doctors would normally do in this situation. It's called the standard of care. So the first thing the doctor needs to do is violate that, meaning they did something that other doctors wouldn't normally do and is not generally recommended. The second thing that happens is just because a doctor does that doesn't necessarily mean it's malpractice. There needs to be some sort of damage. So you need to have some sort of bad outcome because the doctor wasn't following, what they were supposed to be following. And then the third is there needs to be damages. So for most malpractice cases, not only does a doctor need to do something that most people wouldn't do, not violate the standard of care, they need to, and not only did you have some sort of harm, it needs to be like lasting and have some sort of damage that you wouldn't, that's like permanent, or that you wouldn't have had if this hadn't happened, or that you needed some surgery or something else to fix. So that's generally what it is. What it's not is like you get a surgery and let's say you get a knee replacement and it gets infected and they were taking sterile precautions and now you need a second surgery and it's a terrible ordeal, right? That's not malpractice. Or if, let's say, someone goes in for surgery and they have a blood clot and they die on the table, like that's not malpractice. But if someone's doing a knee replacement and they're not wearing a glove, that's malpractice. So, that is a clear violation of standard of care. It's usually when it happens, these cases are hard to win, so a lot of malpractice lawyers only want to take it when there's significant damages and when it's a very clear violation of standards of care. So I'll give you two examples of things I've seen, one that was and one that wasn't. So one that wasn't, this is something that I've seen where a guy has back pain, he gets a back surgery, and he's still in pain. And there's no malpractice there. The surgeon didn't do anything differently or wrong. The surgery just didn't work as expected, but there's no violation of standard of care. And even though he has still his pain, there's no malpractice there. There just isn't. And here's one that is malpractice, or very well could have been. It was somebody that I knew. She stepped on a nail outside, went all the way through her foot, like Home Alone style, and she went to an urgent care, and they didn't even look at the wound. And they didn't do anything for it. So then I had to treat her and clean out the wound and put her on a lot of antibiotics, and she got better. They didn't even get an x-ray. So that would be malpractice because it's not standard of care to not look at a wound when someone comes in for a wound. So that's when you get into sort of indefensible situations or using non-sterile instrumentation. But generally, violations of cleanliness or sterility are pretty easy malpractice cases. And then once you start getting into other things, you really have to prove that the doctor did something really way out of bounds. But if you have a surgery that failed or just a complication from it, that's not really malpractice. So I hope I was able to answer your questions about when malpractice occurs and when it doesn't, or medical malpractice. If you have any questions I didn't answer, feel free to leave them in the comments below. If you like this video, we put out new content weekly, so please like and subscribe. If you have any questions about your condition or your medical case or anything like that, I can't really answer them over YouTube because this video and all my videos are for educational purposes only.